Hello, my name is Maddie and I'll be your nurse today. Alright, so we're just going to do the full physical assessment today to check up on your health, see how you're doing. The first thing that I would start out with is just a general inspection. I would check for posture, grooming, hygiene, any deformities like an amputation, anything like that. If she's got any mobility devices like a cane or a walker, and a general assessment of level of consciousness, skin color, nutrition, stuff like that. I would then ask a couple of questions to assess her orientation. The first one is, do you know about what time it is right now without looking at a watch?
Maybe 4:30,
Okay, and do you know what the date is today?
December 9th, 2017.
Okay, do you know where you are right now?
I'm in my home.
All right, and do you know what the situation is?
I do.
Could you tell me what it is?
You are filming for your nursing school project.
Okay, and while she was answering those questions, I would also just be doing an assessment of her voice to see if she had a regular speaking pattern, if she had any hoarseness, anything like that, and I would also be observing how well she could hear, and I would also ask if she used any personal devices like a hearing aid. I see that she has glasses, any contact lenses.
No.
And do you have dentures?
No.
Okay. Then I'm going to move on to a set of vital signs. So I'm going to take your blood pressure first. Just go ahead and relax your arm there. Straighten it out a little bit. It's about 116 over 80. Alright, I'll just write that down real quick. Alright, and then I'm going to take your pulse and I will also be counting for your respirations. And I'll do 30 seconds each. And I'll just look at the clock over there. All right. All right, and then I'm just going to take your temperature. And I would also check your oxygen saturation. And then finally, I will ask you if you're having any pain.
No.
Okay. All right. Now I'm going to move on to a general assessment of your skin and nails. So if you could just pull up your sleeves there, so I can just take a look. Skin color. All right. And I would just be checking, doing an inspection for color, make sure she wasn't having any pallor or redness, any discoloration. I'd also be checking for texture to see if there was any dryness, anything like that. I'm also checking for moisture. It should usually be dry. And I'm also looking for any lesions in the skin. Do you have any open areas that you know of on your skin
Not
anywhere?
that I know of.
Okay. Then I would move on to an inspection of the head and face. I would just do a general inspection for skin color and stuff like that. And then I will palpate the scalp to check for texture of the skin and hair. Alright. And then I'm going to check cranial nerve number 7, which is the facial nerve. And by doing that, I'll ask you to raise your eyebrows, smile, frown, show your teeth, puff out your cheeks. Okay, and then I'm just going to have you clench your jaw so that I can palpate the temporal muscle and the mandibular muscle. And then I'm going to palpate the temporal mandibular joint, so I'll just have you open your jaw, and I'll feel for that. Close it, open. All right. And then I'm going to palpate the maxillary sinuses here under the eye and the frontal sinuses to check for any swelling. Then I'm going to move on to the eyes. First I'll have you stand and close your left eye and read as far down as you can on the chart. Start with the line you can.
PECFD.
All right, and the next one.
EDFCZP.
Okay, and then close the other eye and read the lowest line that you can read.
FELOPZG.
All right. Can you read one below that?
DEFPOTEC.
All right, and now open both eyes and read the lowest one you can read.
LEFGDFGT.
Okay, and the one underneath that?
No.
Okay, that's fine. All right, and then I'll have you tell me what this color is. What color? The line. What color the line is?
Green.
And then the one underneath that?
Red.
All right. All right, you can take a seat. All right. And then I'm going to do Perla. I'm going to just look straight at me and I'm going to shine this light in your eyes. Okay. All right. And then I'm going to test the cardinal positions of gaze. So I'm going to have you look at the tip of my pen and just follow it. Okay. Then I'm going to check just the general structures of the eyes for any discoloration, any excessive drainage, anything like that. Do you have any problems with your vision besides, I mean, obviously the fact that you wear glasses, but are they ever like over watery, really dry, anything like that?
Sometimes this one is dry.
Okay. And then I'm going to move on to the ears. I'll check the external ear for any lesions, drainage, discoloration, any other abnormalities. And then I'm going to check the internal structure of the ear with the otoscope here. Typically the inside should be like a pearly, grayish pink color. Alright, that one looks good. Alright, looks good. Alright, and then I'm going to do the hearing test to test cranial nerve number 8, which is the acoustic nerve. I'll have you close one of your ears, and I'm just going to whisper a 2-syllable word, and I'll have you repeat it back to me.
Pancake.
Alright, and the other one?
Football.
Alright, good job. Okay, I'm going to move on to the nose now, just a general inspection as well first, and then I'm going to ask about if you have any tenderness, if they're patent, if you're able to breathe well through them. And I'm just gonna take a look externally. I'm gonna use my little light here. Alright, just to check for patency. And then I'm going to move on when I'm doing that, I'm checking to make sure there's not any lesions or discoloration, that the mucosa looks normal. And then I'm going to move on to the mouth and throat. Again, I'm going to use my light here to inspect the tongue, the teeth, the mucosa, check the tonsils, check the palates in the mouth, and I could test the gag reflex as well. I won't do that, but to check for cranial nerves 9 and 10, and then I'll check the tongue as well. Could you stick your tongue out? All right, and say light, tight, and dynamite.
Light, tight, and dynamite.
Okay, and then I'm also just checking for